and welcome back to NK Natural Therapy. Today we will be discussing a very important but often misunderstood topic, gonorrhea. Gonorrhea is a common sexually transmitted infection by a bacterium known as Neisseria gonorrhea. Christmas is around the corner, so you need to understand what is gonorrhea, the symptoms, and how it spreads, and how you can actually protect yourself. So let's get informed in this season, because if left untreated, gonorrhea can lead to serious health complications, including infertility. So let's get informed. So what exactly is gonorrhea? Gonorrhea, also known as the clap, it's a bacterial infection that can infect various parts of the body, including the throat, the genitals, and the rectum. It spreads through unprotected sexual contact, including the vagina, the anal, and the oral sex. This actually means that anyone who is sexually active is at risk of contacting gonorrhea, especially without proper protection. So let's break down the symptoms. The symptoms usually present in men in different ways and in women in different ways. In men, it presents, number one, pain during urination. You know, that kind of burning pain when you want to urinate. Secondly is pus-like discharge. Sometimes this pus-like discharge present with different colors. It could be white, it could be greenish, and it could be yellow. Next is swelling or pain, swelling and pain in one or both of the testicles. Your testicles are these sacs right here. So let's go over to women. What happens? How do you know that as a woman, looks like you have contacted gonorrhea? The symptoms always tell us what is happening. So number one, it's pain or that burning sensation during urination, just like it happens in a man too. Secondly is increased vaginal discharge, but this time around, this discharge can come with foul smelling, or you just notice that something is off with the discharge. It's not normal. Like, this is not the normal discharge that on a normal day that you will have as a woman. The third symptom is pelvic or abdominal pain. Pelvic or abdominal pain, you just notice that your abdomen, that is below your waist, is paining you. Okay. Fourthly is this bleeding in between your periods or after intimacy. I will say that the Neisseria gonorrhea can affect various parts of the body. So assuming that it affects your throat, you could be experiencing sore throat, or sometimes there is no symptoms at all. Or this recurrent sore throat infection, you will treat with strepsil, all kinds of antibiotic. 1 month later is back. 2 weeks later is back. 1 week later is back. Okay, so when it affects the rectum, here are the symptoms that you could be experiencing: discharge, itching, soreness, or bleeding after a bowel movement. After you have used the bowel, after you have used the toilet, you will notice that there's a bleeding, like, some kind of spots around, and you notice that your anus is always itching you, or sometimes there's this soreness around that place. My dear, don't keep quiet. So let us look at complications of untreated gonorrhea. Assuming you're having all these symptoms and you decide to, close your ears, close your eyes, like pretend that there's nothing happening. What are the likely complications? The complications varies between genders. So in a man, there could be epididymis, a condition known as dermatitis. This condition can actually affect your ability to get a woman pregnant. Have you seen how gonorrhea can actually lead to infertility? Then in a woman, to pelvic inflammatory diseases that can actually affect the fallopian tube, yes, and cause scarring and can lead to ectopic pregnancy. It's not all the blocked tubes that are caused by just fibroids or polyps. Sometimes it could just be as a result of gonorrhea. So, but in both man and woman, look at what goes on. Gonorrhea can actually spread through the bloodstream and affect the joints, causing a condition known as disseminated gonococcal infection. Symptoms of this condition include fever, joint pain, and skin lesions. Diagnosing gonorrhea is not a difficult something, but it's very simple. So a urine test can be done, a swab test can be done, and a blood test can equally be done to ascertain if you have gonorrhea. Please don't keep quiet if you're experiencing any of these symptoms. Let us know the one that you're dealing with, okay? So the treatment, the good news is that there is treatment. In fact, many people that go ahead and comply with their treatment don't experience any complications. Like, the symptoms disappear Phew, it's so easy to treat. You just need an antibiotic, okay? A ceftriaxone injection can handle this. Just consult with your healthcare professional so that they can give you this ceftriaxone infection, the right dose and the right time. So how do you prevent this gonorrhea? Preventing gonorrhea starts by you making informed decisions about yourself in this. Jump into bed with somebody you don't know out of the blues without protection. That is not making an informed decision. Secondly is get tested regularly. As long as you're someone that is still sexually active, please get tested regularly, especially when you have the symptoms showing up. This is communicate with your partner. Yes, have an open discussion with your partner. Ask questions, ask intelligent questions like how many persons have you been with? Have you experienced this before? Because sometimes somebody can have this gonorrhea and they're still at the incubation period and it's not showing the symptoms, okay? With that, you're able to make informed decisions for your health. Avoid risky behaviors. Some of these risky behaviors is jumping into bed with somebody you don't know. Yes. And sometimes the person is even showing signs and symptoms. Like you can obviously see the signs and symptoms that this person is sick and you still insist. That is a huge risky behavior. A few myths about gonorrhea. Sometimes people have this mind that this is how you get gonorrhea. For example, that you can catch gonorrhea from a toilet seat. Here is the truth. Gonorrhea does not survive like HIV outside like that. And it doesn't even have that encapsulation. So that is not. True myth is that you will always know if you have gonorrhea. No, you will not always know if you have gonorrhea because many people don't show signs and symptoms. Just like in cases of hepatitis, it's not everyone that shows signs and symptoms. So we have healthy careers too. So that is why it's important you don't involve in risky behaviors that put your health at risk. Conclusion, gonorrhea is a serious health complication, is a serious health condition, but amazingly is easily treatable, preventable with the right steps. Aware of the symptoms. Prioritize testing. Prioritize your health. Take care of yourself, especially in this season. Let no man deceive you. Don't be deceived, okay? A lot is going out there. Many a times, people are aware that they're carrying a certain condition. They will hide it, pretend like everything is all right.